route in which you're giving it, okay? A lot of medications can be given both IM and IV, so you wanna make sure that you're giving it the right route, correct? Alright. So you'll reconcile your one medication, then you'll reconcile your second one. Then you're gonna, provide patient privacy, and you can tell the patient that I'm giving you your blood pressure medicine, or we're giving you Pepsid. Pepsid, what is it used for? GERD, right? So for your reflux or any kind of tummy issues you have, we're giving you medicine for that. We're gonna be giving you your Lasix. What do we give Lasix for? Blood pressure, fluid overload, right? This one right here with the O, what is that? No, Zofran. This is Zofran,
Nausea.
okay?
Yeah.
On, I think, the first list that was put out there, it was named Zofran, but remember that the O one is Zofran, and Zofran is for
Nausea.
nausea, correct. The next one is this long D word, which is what? Benadryl. That is correct. There are at least one of these medicines that you have to do a medication calculation for, nothing two. That's not straightforward of what's on the bottle, okay? So don't be alarmed when you pull your medicine and it says, what's one of them there? Okay, so here, this is Lasix. Lasix is 20 milligrams per 2 mil. If I want you to give 40, how many mils are you gonna give?
4.
Correct. All right, so easy. So don't freak out if you see something different on the bottle than what the order actually says. All right, so now you have your medicines. You've done your first check on your medicines. You're at the patient's bedside. You're gonna provide that privacy, and you're gonna verify the patient's allergies. You've already looked at it in the chart, and it says no, he has no allergies. You just want to verify with the patient. No, I don't have any allergies, so that you can go on and prepare your medication. So you're gonna assess the patient's IV, right? Do you have any allergies? No. Well, I'm just gonna take a look at your IV and make sure that it looks okay. All you are is visualizing the IV. Does it look red? Does it feel warm? Or actually, it's a look-see. Does it look okay? Is it falling out? Is the dressing nasty? Whatever. Okay. You're just assessing the IV site for inflammation or infiltration. Now you're gonna go back to your medications. You're gonna check that the EHR record order with the medication that you have. You'll scan the medication. You'll do that reconcile. That's your second check. You'll go ahead and don your gloves. Then you'll go ahead and prepare your medication. All right. So medication 1 is that you're going to withdraw the correct amount of medication. So you have chosen your medicines. You've pulled them out. You've done your first check on your med, and now you're going to actually do your medication calculations and draw up your medication. Okay. So we did Lasix. It's 20 milligrams per 2. We want 40. We want 4 mils. We're going to go ahead and draw up our Lasix. Because we don't have time for you guys to label the syringes, we're saying put your bottle with your Lasix over here, put your syringe on the opposite side of the bottle, and then draw up your second medication. But verbalize to the instructor that realistically I would label my medications so that I knew which was which. If you want to draw up your medicines in 2 different syringes, because Lasix is going to be 4 mils, if you want to use a 5 mil syringe or a 10 mil syringe in order to draw up your Lasix, and then your Pepsid is only going to be 2 mils, use a 3 mil syringe, so you have 2 different identifiers that your syringes are different, you could do that too. You know, just so that we know that you're considering that if you put those 2 10 mil syringes there on the table, you don't know what medicine you're pushing when, right? Because if your patient has a reaction to those medicines, what did you give? Okay, so that's why we want you to know that in real life you're going to label it, but because of the skill being timed, we don't have, all the time to be able to do that. And that's where my error came in, because I draw one medicine up, push it, flush it, draw the other medicine up, push it, flush it. So that's where my error came in, because I was just giving you my practice versus what the book says. Okay? All right. So we've got both of our medications up. We want you to verbalize that you labeled the syringe, even though that you didn't. Okay? okay? And that is your third check. You're gonna go to your IV site, you're gonna go ahead and scrub your hub. You're gonna attach the saline to this. You're gonna do a pullback on the saline, correct? You know, you're gonna check for placement, you're looking for blood return. Do a gentle push, make sure that you don't meet any kind of resistance. In real life, if you may or may not get blood return back, but when you do that push, you might meet some sort of resistance. Make sure that you've unlocked the saline lock. I've done that many, many times. It's like, dang, what's wrong with this IV? I can't get a drip up, you know? Or if you're doing it up in an IV line that you'll learn with the next skill, it's the same thing. You've got to do something with the clamp or undo your IV altogether in order to be able to check that patency, because the clamp is going to regulate your draw. Okay? So make sure your clamp is open. Do that gentle push. If you can't push, you might be up against a valve or something, so you may just have to do a little tension, pull back on it, and see if you can get it to flush that way. This should flush for you, okay? So all we're doing is checking to make sure that you get blood return and that you flush the line, okay? That is not timed. You just push it. Not fast, but just push it, because you don't want to blow. While you're pushing that, you'll say, I'll be observing for infiltrate. Okay? So now you'll get your medication, you'll attach your medicine, you'll administer your medicine, one line, 4, 5, 6, whatever, one line, 2, 3, 4, whatever your time period is, and that should be about 2 minutes that it takes to infuse those medications. All right? About. You have to do the math. Like I said, I haven't got that far yet. So once the medication is administered, you would take it and you would put it into the sharps box. We are not putting it into the sharps box. We set it to the side because we're recycling all of that stuff. So like if you bring syringes, you can take your syringes, but we want the blunt needles to be able to use for the next lab. All right. So then you're going to do what? What do we do after we do the medication? Flush it. And we're going to flush it with how much? 5? That's fine. You can do 5 mils, because then you only need 2 syringes versus 3. So you go ahead at the same rate that you gave that medicine, you go ahead and you flush your lock. Now you're going to give your second medicine. Ideally, you would scrub the hub, you would attach your medicine, and you would administer that medication over the same period as you calculated out. Medicine 2, 3, 4, 5, 6. Medicine 2, 3, 4, 5, 6. Right? Okay. All the medicine is in. You're going to take the saline syringe. You're going to administer. You'd ideally clean the hub because you're putting a new syringe on that. Take the saline syringe. You would flush it at the same rate that you administered that medicine. Okay. I would say 5 cc's. If you're going to use a 10 cc and flush 10 every time, you know, just because you're like myself in our anal, you know, you can flush it with a 10, make sure 5 is counted for so that at least that line is flushed so that you're not giving the patient a bolus. All right. Let's see what else. Then you're done. Okay? You can make sure that you verbalize that you checked there's no infiltration on the IV, there was no pain. You can verbalize all of this. No pain. While you're giving the medication to the patient, you can ask them, are you all right? Are you all right? Are you having any burning? Or, you know, make sure you're not dizzy. You know, you can just ask them, are you okay during the medication administration? Because sometimes people will, when you're giving medicine, sometimes they'll have like maybe a sense of nausea. They'll get a metallic taste in their mouth or something like that. So just ask them, are you okay? It burns. You know, some people are real sensitive and they may say that it's burning a little bit. So you may want to just slow that down a little bit more. And then make a note, because maybe the next time you'll want to dilute it so that it's not, because I mean most medicines you can dilute, it doesn't matter one way or the other. It's just those that have to be diluted. All right, then you're going to remove your gloves and wash your hands, and then what do you do 30 minutes after? You just go back and say, you know, do you feel better? You know, are you still having discomfort if you give Pepsid? You know, do you need to go to the bathroom if you gave Lasix? You know, just to make sure that, you know, the patient is comfortable, and then that's it. And then when you're done with all of that, you'll go over to that computer, or if you bring your own laptop, you can sit here at the table and all you need to chart in the EHR is your site. That's it, your IV site. You know that there was no redness or infiltrate noted, and that's under the flow sheets section, and then intervention. Okay, yes.
So, are we gonna have a computer here while we're doing it? Cause we have to check
Scan it.
AR. We're gonna be scanning.
Yes, there'll be a laptop there to scan your patient and to scan the medicine.
So we'll be charting that also then, but we'll chart that here.
That will be charted it's like simultaneously as you're giving it. As you're giving the medicine and you're doing all those checks, you pull the medicine and now you're gonna do your second, you scan your patient, you scan your medicine, you reconcile your medicine, you scan your medicine, you reconcile your medicine, you draw up your medicine, and then you walk over to the other side of the table where your patient is, and you're administering the medicine.
Okay.
Basically. Any more questions?
Will it have the rate on there? Like how long we're supposed to give it? No?
You have to figure that out.
Okay.
I will have the rate on my paper, but you
Do we need to know the patient's reaction to the procedure?
You do not need to write that down, you just verbalize that you would go back 30 minutes after medication administration and check on the patient, that's it, all you have to do is verbalize it. We're trying to keep the charting down to a minimal, but on this last, lab, when I was looking at my classes, they would put an IV note versus charting in that section, and so you miss so much information if you just don't hit that checklist, because that checklist like tells you everything that you need to chart on that IV. And of course, you don't have to worry about, the IV's already established, so you don't have to worry about that you established the IV. Just verify that if it says 18 gauge or 20 gauge, what color is an 18 gauge?
18 is green.
Right, and what color is a 20?
Pink.
Pink. Yep, so all you have to do is when you're pushing that, say, oh yeah, that is a 20 gauge, I'm gonna make sure that that's what's charted. You don't have to chart, how they cleaned it. We don't clean with alcohol, the site, we use that chlorhexidine stuff. So make sure that whenever you do start your IVs, you chart the correct medicine that you're starting your IVs. What else? What else can I answer you?
Do we need to scrub the whole 15 seconds or just verbalize it?
You scrub the hub. However, it says on the rubrics for the allotted amount of time, but you can say I'm scrubbing the hub and I would wait 15 seconds because it needs to dry.
So you can verbalize that.
Just do that first scrub, you gotta do that first scrub.
So on this, it says the list of drugs, it says 20 milligrams, like 2 mLs, is that just? you
The
guys
new
putting
one,
that
we
in?
took all of that off,
Okay, you just gave us the drugs.
just the drugs.
Okay.
Because you will verify, when you go and pull your medicine, cause some tables may have 20 milligrams per 2, they may have 40 milligrams per 4. We did not want you to see that dosage and say, oh my God. And then just that change, because you're not used to seeing that. This paper said it was supposed to be 20 per 2, and Pam made it 40, in 4. We did not want to confuse you, so we got rid of the mils on that, milligrams and the mils on that. So it just has the medicine. What else? What else? What else you wanna know?
Will there be flushes? There will be flushes here, right?
The way that it looked when we came here, that's exactly how it looks. So at the end of the skill, what we're gonna ask you to do is take your blunt tips. That's why, although ideally, we would throw it into the sharps container after we administered medicines. Because we are reusing supplies, we're not gonna throw anything away. So you could just say, all of this would go in the sharps container. Or the sharps would go in the sharps container and the syringes would go in the trash. Type of thing. Yes.
Might be trivial, but we're going in and asking the patient's allergies and getting their ID, and then we're walking out of the room and going to get the medicines? I mean,
No.
how's that?
No, this is
it's
all gonna
at the
be,
table.
Right, I
Okay.
understand that, but then you walk around.
no, think about your clinical setting, okay?
Mhm.
We're trying to mimic some sort of hospital setting as much as we can, okay? In the hospital setting, or even in your clinical setting, the nurse goes to the Pyxis, which is a medication room that's out of the patient's room, right? She pulls all of the patient's medicines and either puts them in a cart, or she goes to the patient's bedside in order to administer the medicine.
Right.
This is your patient's room, okay? If you were in the hospital setting, you would have a computer on the wall, just like the computers here at the bedside, you have a computer on the wall, You have a countertop right there by the computer where you can prepare your medicines. You've got the sink right there, and your patient is right here. So yeah, your patient, you can have your back to your patient. You're already in the patient's room. You know who your patient is. You check the allergies in the Pyxis. So you knew that that is safe, right? Now you're in the patient's room and you just want to verify that the Pyxis is correct. You know, because the patient may say, oh, that's the other medicine that I have an allergy to. Well, thank God, because if I already prepared it, now I've got to throw it away because you have an allergy to it. We've got to get something different. So everything, this is going to be pretended like you were right in the patient's room.
Okay, so if we're in the patient's room, we're gonna draw up the meds in the patient's room?
Yes, ma'am.
Yeah.
And that's exactly how you will practice in real life. If you're in like an hour clinical group, the nurse gets the medication, she puts it in a medication cart, the medication cart is locked.
Right.
We go to the patient's room, right to the room, we scan the bracelet, we go back to the medication cart, which is right there at the doorway of the room. We prepare the medication, we bring the medication to the patient's bedside, and we administer the medication. Right? Is that right?
Yeah.
Okay. Yes, sir.
So since it's timed, let's say the rate says over 5 minutes, do you want us to do the
Nothing's
whole
gonna
5
be,
minutes?
nothing's gonna be over 5
Okay.
minutes.
But you want us to do the whole thing?
Nothing on my skills is gonna be over 5 minutes.
Okay.
If you were giving Rocephin IV push, yes, that's gonna be,
Okay.
I would say closer to 8 or 9 minutes. Because your patient's blood pressure will plummet. Been there, done that, got a t-shirt for it. Scared the crap out of me. Because, you know, when I went back to the hospital setting, I was gone, I was in freestanding, and we don't do IV push antibiotics. We hang them in a bag. So when the hospital said to push it, I'm like, oh my gosh, I've never pushed this before. And the recommendation was over 5 minutes. Well, I did it over 7 minutes. My patient's blood pressure still took a dump. And I was like hitting the call button because I needed a liter of fluid in order to bring them back up.
Okay. So I guess you'll want us to do the whole thing. Okay.
These medications typically will be over 2 minutes. You know, whenever because they'll tell you in your drug book, you know, how long it should be administered, and then you just divide whatever size syringe you're using into your, you know, your minutes into your syringe size. You know, so you know that if you're giving 2 mils and you want to give, say the book says 2 minutes, by the time you get to 1 mil or 1 minute in, you're halfway done with your syringe. Yes?
So the way that our EHR works, in order for us to document the medications, we have to scan it and put in the information and then submit it right then. So as we're going about it, could we be like, you know, scan, first check, type it in, submit, scan, second check, type it in, like that?
Yes.
Okay.
Yes, because again, in real life, you would have gone to a machine out of the patient's room and typed in the patient's name, and the drawer would open, and you pull that medication out of the machine, right? And you would put it in your pocket, and you would go to the patient's bedside, and you would prepare it, okay? I'm sorry, can you tell me your name and your date of birth? Get the tip, scan their name, yes, this is, bracelet matches the name that I just asked for, it's the same name in the computer. The medication, the MAR comes up, and then you'll scan the medicine, and that is your second check. You've done your first check at the Pyxis, when you actually pulled out the medicine, okay? So, for our purposes, when you pull your card, that's your order, that would be in the Pyxis, and you would just check, when you pull your medicines, that's your first check. That's trying to simulate that you went to a Pyxis and pulled the medication out on your patient. Yes? Do we feel a little bit better about Tuesday?
Professor, I
Okay.
have another question. So
Yes.
for example, furosemide says push over 1 to 2 minutes.
Yes.
So as long as we're in that range, we should be fine?
Yes.
Whether, okay.
So we can do a little longer if we like.
She said.
Little longer is better than a little under.
Right, that's what she said. It's better to
like
go
that.
over than under. You don't wanna push it too
Okay,
much.
so say you gave Lasix and your syringe, I don't know if your instructor showed you the twisty method or the push method.
No.
In my opinion, twisty method, you have more control over the plunger, okay? So when you're instead of pushing the plunger, just take it, give it a little push and twist.
Oh,
push and twist,
haven't tried.
okay? You have a
Haven't
little bit more
tried that.
control over your plunger, because some of those
Nobody
plungers,
teaches
depending on
about
the brand, that slide and shoot, you just gave them a bolus and you didn't want to. So I don't want you to sit there and have an OS moment because you push that medicine,
Oh, shit.
okay? If that happens, okay, if you push and you deliver more than a line or two or whatever, just tell the instructor the syringe slipped, the patient got a little bit more. As long as you know you messed up, okay, we're good with that. As long as you know, just like with the sterile technique, with the Foley, as long as you know that you contaminated your sterile field or your Foley went onto the table, as long as you know that that's wrong, we can't ding you for it necessarily because you told me that you did it wrong. And I would go and get a new kit and I would do this, this, and this. So you just need to practice the timing on delivering that medication over that period of time. You know, how many lines, whatever, and just give medication, 2, 3, 4, 5, 6, medication, 2, 3, 4, medication. Because if you push that Lasix too fast, what would happen to your patient? Yes, which is?
Hearing
Yes.
problem.
You know, and it may take time for it to come back. So, and that would be your fault. Okay, what else?
So for the seconds per line on that video, some of them, are we just counting the lines?
You are just counting.
Just the lines, cause it was saying like 1 is 10, 2 is 20, so we were over here thinking it's 20.
I don't know anything about that. I
Just
told you,
count the lines.
were you in my lab Tuesday?
Yeah.
Cause I told you guys how I do it.
Okay.
I have, this whole counting, putting a seconds to each line is kind of new to me, because I've never done that. I just take, if I'm giving medicine over 1 minute, and I have 1 mil, I know in 30 seconds, that's why I look at my watch, I know in 30 seconds I should have a half a mil left. I know that in 15 seconds, I should have 3/4 of a mil left. That's why I watch my watch. You know, cause if it's a mil over a minute, I just sit there and you just divide it in half, it's all pie, right?
So when you have to do the,
You just, in real world, you just push it real fast.
when you have to do the flush afterwards, you have to do it at the same rate, you just.
The same rate of the medication you just administered, okay?
So you just do it by
You,
the,
in a saline lock,
uh-huh.
you still have medication that is in that saline lock. So if you just flush,
Mhm.
if you just flush that saline through there, you just gave them a 1 mil bolus.
So you said do the, like, if you're flushing with 5 mLs, you just time it over the same amount of time that you
2,
did.
3, 4, 2, 3, 4. You just wanna push it slow until you get at least 2 mils into the patient's arm and then you can flush the rest.
Okay.
I don't know how many mils are held in a saline lock. I just always push it super, super slow because I don't wanna give them a bolus.
Mhm.
And the biggest thing is during blood pressure medicine.
Okay.
Yes, yes.
Demonstrate.
Okay, where do you want me to start?
Right here.
No, no,